can you please chat in our chat box which are the countries are participating today? So as ma'am said in the first session, we want to connect the international people. So we want to know how many countries are participating from in each and every day meeting, daily based meetings. So please chat in chat box. Then that will get more confidence for us. Okay. So I would like to call Dr. Josa. He's the main thing is that he's a steering committee member of International Forum for Promoting Homeopathy, and he's one of the founder of IFPH, and is a former professor and head of Department of Government Homeopathic Medical College and Hospital, Trivandrum, Kerala, and visiting professor, Friendship University, Moscow, Russia, and chairman, Postgraduate Board of Studies, University of Kerala, India. Former chairman, Finance Committee and Committee for Excellence in Homeopathic Education of Central Council of Homeopathy, CCH, Department of Ayush, Government of India. Former chairman, Board of Studies in Homeopathy, University of Kerala and India. So, Dr. Josa, please.
Thank you, Firoz. Dear friends, colleagues, and promoters of homeopathy, this question of why homeopathy or how we can become the #1 came when we read the report of the WHO in 2019, where under the traditional complementary medicine, we have seen homeopathy is regulated and practiced in more than 100 countries. So when we look at it, what we see is just behind us, we can see the Chinese medicine, Ayurvedic medicine, etc. So when we study this report, what we can understand is these systems, the Chinese system, the Ayurvedic system, which are all there for the last 5,000 years, have been surpassed by homeopathy, which is just 225 years old. That's not a small achievement. And another important thing which we see is when we look at the statistical data and everything, there is a 14% growth every year in the pharma industry of homeopathy. And by 2027, our total pharma market will be $18.6 billion. I don't know how many of us know these things. And what we have achieved in these 225 years is not because of the support of any government, not because of the support of any pharmaceutical companies or media promotion or by mandatory vaccinations or any disease control programs. So there lies the real merit of homeopathy. Only because of its real merit, it came up to this level. And although WHO is there for the last 70 years, in the last decade only they have started looking at the traditional and complementary medicine. And out of the 178 countries, member countries, they found that, or the governments in 100 countries have reported that there is homeopathic practice in their country and it is regulated in some way or other. So this is the background on which we started thinking about why homeopathy cannot become or could not become the #1 in the world on the field of medicine. So actually, when we look at the whole scenario globally, what we see is the situation of homeopathy in different countries are different. And to study homeopathy, it is people who are coming to study homeopathy in countries other than India are mostly allopathic doctors, nurses, veterinarians, dentists, naturopaths, osteopaths, pharmacy graduates, etc. They are not coming to get a job, but after going through the homeopathic philosophy, they have found that this is the medicine for the next century, or this is the most appropriate medicine which can cure the problems in a complete manner. Because everywhere we can see that most of the people are taking allopathic medications, and people look for another system of medicine when only the allopathic medicine fails or when they cannot give a permanent cure. So here, why I said there are different situations in different countries is because in USA, Canada, and Asia, we have anybody who studies homeopathy can practice, but in European countries, the problem is only people who have an allopathic MD can study and practice homeopathy or other systems as a specialization. So this is one of the areas which we have to look into. Then another thing is, there are certain unpleasant truths which is actually a stumbling block for us to become number one. There are, which we call in medicine, the intrinsic factors. That means the internal factors. One of the most important one is the lack of proper clinical training in our colleges or in our academies. Second point is the lack of classical practice of classical homeopathy. Although homeopathy was discovered during the time when there was a lot of mixing of medicines and Hahnemann was against it, and he came up with this single remedy principle, which is a cardinal principle of homeopathy. But now we know many homeopathic doctors are prescribing combinations. And the real merit of homeopathy is not known to the public in a way, because many people are practicing homeopathy in an allopathic manner. That's one of the reasons. I think why can't they put all these homeopathic medicines, there are around 1,500 medicines, in a jar and give it to every patient so that everything will be cured if we follow their principle. So this is one of the main problem, and that is one of the reasons why 50% of the possibilities of a real homeopathic system is not felt by the community in a way. Then there are, in the West, there is one problem. That means many quacks and people who are selling health products join the Homeopathic Association, and they use this association as an umbrella for their promotion, giving promotion to their products or something like that. This is another problem. Then what to do? Because we have only 10 minutes, I am just going into what we should do to bring in homeopathy as the #1 system in the world. In a way, we are #1 as a curative system of medicine. We all know that there is no cure for diabetes, blood pressure, arthritis, hormonal problems, high cholesterol in allopathy. So people are looking towards homeopathy when they feel that allopathy cannot cure them, or when they start feeling the side effects of the medicines which they are taking for 5 or 10 or 15 years. So at that time, they come to us. So that's why I said, we have to tread in a different stream. These are like a parallel lines, allopathy and homeopathy, which can never meet, because both of them are based on different principles, and it cannot meet. One is for cure, the other is for temporary measures like suppression or anything. But they have their areas, like in emergency medicine, accidents, or mechanical problems. They can do many things. And actually, in the last 100 years, allopathy was depending more on the vaccinations and antibiotics for their survival. And surgery is not a part of any medical system. If we say, we all know that the surgery was found by Sushruta, who was an Ayurvedic doctor. And at that time, it has got nothing to do with the Western medicine. But now what we see is this surgery, actually everything in surgery depends on the technology available at that point of time. Now we know that many surgeries, the laser is coming, laser therapy is there, laser keyhole surgeries. Many of these things are actually the offshoot of technical advancement, not a part of any system of medicine. But because it is done in an allopathic hospital in many countries, we think that it is allopathy. Then the next thing which I would like to say is, we need a proper course in every country under a university. Maybe there can be two types of courses. One for the people who are already doctors, maybe a 2-year course will be enough for them. Because I am in touch with so many doctors, around 300, 400 doctors outside India and in Europe. So what we find is they have already studied the basic science, the basics, things like anatomy, physiology, pathology, primitive medicine, everything. And what they need is training in the homeopathic subjects like organon, materia medica, and repertory. And of course, those who are coming to homeopathy as a beginner, a fresh hand, needs our own BHMS course, a 5.5-year course. The second thing what we need is the government recognition. Government recognition means we need regulatory councils, educational institutions, and hospitals under the government. We all know that India is the country where we have an Ayush system, an Ayush ministry, exclusively for Ayurveda, Unani, Siddha, and homeopathy. And the strength of homeopathy in India is our 242 colleges exclusively for homeopathy, around 25,000 dispensaries, 29 research centers, our own government pharmaceutical companies. Actually, these are the pillars of strength for homeopathy in India, and other countries can follow. And we have this research. Many people used to say this research is a highly integral or a highly wanted part in the development of any system of medicine. And we have the private and government sector for research, but there are some problems. It's not like in the allopathic field where if a pharmaceutical company finds out a medicine for the first time, they get the patent for that medicine in the next 10 years. And by that time, they can make millions, billions of dollars. So they can go and spend so much money for research in their field. That kind of thing is not there in homeopathy. This is one of the biggest hurdles in homeopathic research. Then the next one is, we have to identify, as Dr. Ina has said, marketing is very important. We have to identify the areas which we can excel and we only can excel. Actually, in acute diseases, we know it has a certain period, definite period, and it will go off, and 90% will go off even without medicine. And our real merit lies in the treatment of chronic disease, which constitute 80% of the diseases in the world. So these are the mainstay for homeopathy. We are the only system which can cure these chronic diseases completely, and also the psychosomatic diseases. No other system can boast of such a thing, because homeopathy always aims to cure the patient. And the only problem is we don't have enough media support or government support or pharmaceutical support. So this media support is the next one which we have to look into. Now we have the social medias, newspapers, visual medias, etc., playing a big role, and they can make or break a system. That is the situation now. Another important thing is the political support. We all are treating politicians, and they are finally the ones who have to decide what a government should do. But many of them are convinced of the efficacy of homeopathy, but they don't transform it into the grassroots level or into action. They are convinced, but they don't do anything. So it's our duty to make them understand that something has to be done concrete, and every homeopath should know what we want. And that way we can educate them, we can make them supporters of homeopathy. And the second one is the bureaucracy, which is next to the politician or the ministers. This is the bureaucracy. The bureaucracy have a big role in executing the ideas of these politicians. They are the ones who have to come up with some projects and how to execute it and how to make it reach the common people in the world. So their support, and it is we have to convince them also. And the next one is the insurance coverage. In many countries, and even in India, it's becoming a very common thing. And the insurance companies plays a big role in the field of health and insurance coverage for homeopathy. That's what we have to aim to get. And now we see that many insurance companies are slowly giving reimbursements for homeopathic treatment. We have the State Bank of India giving reimbursement for homeopathic medications. And even in US, I have seen California, many of the insurance companies are ready to include homeopathy also as one of the medical systems in insurance. And the last one I would say is the integration of medicine, because many people are talking about the integration of different systems of medicine. Actually, I think in Europe it is already there, because many dentists are using homeopathy, many doctors are using homeopathy as a curative method when allopathy fails. So every system will have its own sphere, and slowly that will be more and more, it will become clearer. And the people know that to immediately suppress or to get some relief, they may have to go for allopathy, but they are ready to come back to homeopathy for a permanent cure. So homeopathy will remain as the one method of medicine which can suppress, especially in the emergency medicine and all. But homeopathy will be the number one as a curative system. Because nowadays people are becoming more and more aware of the side effects, and even, now it is called Mada, Pida and Google. So the Google can give you the side effects of the medicines which you are taking one by one. There will be a list of side effects for every medicine which they are taking or giving. So, but when we look back again, see, the last decade definitely belonged to homeopathy. You look at because what I am saying is I am a third generation homeopath, and I have seen this, the development of homeopathy in my house itself. So the next decade also will be ours, because no other system has come up in such a pace in the last decade. We were lagging behind many other systems, but we have come up in a big way. It's due to the many aspects are there, because it is cheap, it is available everywhere in the globe. Now the Amazon, everybody is trying to sell the homeopathic medicines. And I think within a few years, there will be all the corporate hospitals in the world will start a homeopathic department. And these are the things which I am seeing. I know that my time is over. Thank you. Thank you for the patient hearing. Thank you.
Thank you, because you know that we have a special session over in 9:30 Indian time. Really sorry, because we want to hear more from you. It was nice information from your side. Thank you. Thank you, Doctor. Thanks for your nice presentation, Dr. Joseph. Anyway, I would like to call our third panelist, Dr. Kim Elia from USA. It's the former